In this lesson, we'll continue our discussion of the spinal cord by taking a look at the internal anatomy of the spinal cord. So we've discussed the meninges around the spinal cord. We've taken a look at the external features of the spinal cord. Let's cut the spinal cord in half now and take a look at some of its features. One of the first things you're going to notice, there's a butterfly shaped area here, or letter H. This is known as gray matter. So we'll take a look at that first. And then surrounding the gray matter here, 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 and then all of this here is going to be white matter. Just by the way, from our previous lesson here, how do we tell the front of the spinal cord from the back of the spinal cord? Now it's easy with this picture because the vertebrae is around it. This is the body, so we know this is anterior. But let's just say we had a picture of a spinal cord without the vertebrae. What I always look for is this. This deep groove right here is the anterior median fissure, right? So from our previous lesson, I had talked about there's a deep groove on the front right there. And this is something, again, I always look for first to tell me that I'm looking at the front of the spinal cord, or the anterior aspect. So let's take a look at that butterfly shape first, area known as the gray matter. All right, so this is the butterfly shaped portion of the spinal cord. Now, gray matter, if you remember from a previous lesson, consists of unmyelinated structures. So anything that doesn't have myelin grouped together is going to appear gray. So as an example, cell bodies don't have myelin. Dendrites don't have myelin. Neuroglia don't have myelin. Unmyelinated axons don't have myelin. Right? Any of those things, when they're grouped together, they're going to appear gray. So there are three important regions that I'd like you to be able to identify and know their functions of. And we call these horns. There's a posterior horn, also known as a dorsal horn, an anterior horn, also known as ventral, and a lateral horn, which is just lateral horn, thank goodness. So let's take a look real quick. If you were to look at the cross section of the spinal cord, again, this is anterior, at the anterior median fissure here. This general region right here is the anterior horn. Down over here, this is the posterior horn. And the little bump in between is the lateral horn. So a little bit about their functions. When sensory, we've kind of followed my cursor right here, when sensory information comes in the spinal cord this way, right, it comes in this way, what it's going to do is it's going to go into the back of the spinal cord here. The sensory information comes in and then it enters the posterior horn. So basically our sensory information is going to be coming in this way, kind of through the back door of the spinal cord over here. Anything that you touch, maybe that's hot or cold, anything painful coming from your body, pressure, vibration, any of those sensations, that information is going to head towards your spinal cord, but go in the back of the spinal cord, again, into the posterior horn right here. Or again, you could call it the dorsal horn. Now, the anterior horn does not receive information, but rather it's going to have outflow. It's going to be efferent. So what happens is this, and I'll show you another picture in a moment. The cell body of an efferent neuron would be right here, and then the axon would go out this way into the spinal nerve and leave the spinal cord that way. So this is where the cell bodies of somatic efferent neurons live. If you remember again from previous lessons, somatic means body wall. So this neuron here would say the cell body would be right here. The axon would go out this way and then go to a skeletal muscle and cause your skeletal muscle to contract. All right, so basically sensory goes in the back door, motor goes out the front door. There's one other motor neuron. Right here in the lateral horn, the cell body would be here. This axon would go out also through the front door here, but then go into this structure here and then head to an organ. So the lateral horn gives rise to our visceral efferents. Those are the efferents that are heading to an organ. And again, if you remember from a previous lesson, our first lesson on the nervous system, that is what we call the autonomic nervous system, right? The sympathetic and the parasympathetic nervous systems, they were part of the autonomic nervous system and they went to organs. This is where those neurons live. Okay, so again, the posterior horn receives sensory information. Right? And sensory information goes in the back door, and then motor information goes out the front door, out the front. The anterior horn gives rise to somatic efferents, right? The efferents that are going to our skeletal muscles, while the lateral horn gives rise to our visceral efferents. Those are the neurons that are going to our organs. So just to go back for a moment, make sure we cover our notes. So again, one more time, guys, the posterior horn or the dorsal horn is receiving sensory information. The anterior or the ventral horn, again, contains the cell body for the motor nerves that exit the spinal cord, right? They're going to go out to the muscles, let's say, right, and cause our muscles to contract. Okay, just as kind of a by the way type of thing, these are also known as lower motor neurons, right? We would actually call these neurons, and I'll show you a better picture in a moment, that would be here and then go out this way, right? We actually call them lower motor neurons. Okay. And then finally, the lateral horn, as I mentioned before, this is going to give rise to the visceral efferents. Remember that the visceral efferents are the autonomic nervous system, so that would include both the sympathetic and the parasympathetic. Okay, so those are the three horns. Again, anterior, lateral, and posterior, and they would be over here too, right? Anterior, lateral, and posterior. I just didn't label them. I didn't want to make it too confusing, but they would be bilateral. Last two things. There is a crossbar right here, right? The middle of the butterfly or the H, that type of thing. This is known as the gray commissure. This is basically allowing the left side of the spinal cord, in this case, communicate with the right side. There's actually neurons that go across this way, and it allows this side to communicate with this side back and forth. So we call that the gray commissure. And then this right here is a canal that's actually running up and down the middle of the spinal cord in the gray commissure. This is known as the central canal, and this is actually the second place where we have cerebrospinal fluid. If you remember from a previous lesson, the first place that we saw cerebrospinal fluid was in here, right there. This was the subarachnoid space. This is the second place. And then in a future lesson, when we do the brain, we'll see the ventricles of the brain, right? The ventricle system is going to be the third place that we have cerebrospinal fluid. Okay, so that is our gray matter. So the area, again, around the gray matter, all of this here, this is what we're going to look at next. This is the white matter. So again, white matter is the area or the tissue surrounding the gray matter, and this now is going to be myelinated structures. So anything that has myelin, like myelinated axons, right, bundles of myelinated axons, they are going to appear much, much brighter white. They're going to appear white. So let's take a look, and this way you can label the areas that we have as far as white matter we call columns. So if you took a look here in the front, all of this is the anterior column. Sometimes we say the anterior white column. This here and here, I didn't label it over here, but it's the same. These are the lateral columns. And then in the back right here, posterior columns. Yeah, those are the posterior columns. So what do they contain? Our columns actually contain, let's use as an example here. I have these little sticks from the lab. Let's pretend these were bundles of axons, right? So these are axons, and they are in the central nervous system. Remember, we call a bundle of axons a tract. So we have tracts that are sending information up to the brain, right? Those are known as sensory tracts. If you go back to the nervous system packet number 1, right? Sensory tracts bring information up to the brain, and then motor tracts bring information down. Well, these bundles of axons are running in these columns, right? Again, we're looking down into that spinal cord, but if I were to stand it up, upright, right, the tracks would be running up and down. So these tracks actually are important because in diseases like MS, multiple sclerosis, that's where the pathology occurs. The myelin and these tracks about axons become like scar tissue. We call that plaques. And now the nerve signals, right, the action potentials don't travel properly up to the brain or down from the brain. So this is where the pathology is in diseases like MS. So there are a number of tracks that actually have names, right? But they're actually bundles of axons that actually have names. I'd like to teach you or cover four of them that are ascending, right? So there's four different tracks that bring information up to the brain, and then I want to tell you about two that bring information down from the brain. Like I said, there's many more than what I'm going over right now, but these are some of the what I think are some of the important ones. Right? So it turns out there are four different ascending tracks. Again, think of an ascending track as a bundle of axons bringing information up to the brain. Okay, so these carry sensory information to the brain. The first tract is known as the anterior spinothalamic tract. So this is what this means, guys. Anterior means it's in the anterior column. It would be in here, right? Somewhere in here. You don't have to know where, but just somewhere in there. And it's going from the spinal cord up to a part of the brain known as the thalamus. So the name kind of tells you the direction of the action potentials, which way they're going from the spinal cord up to the thalamus, right? So it's sensory. Now, the anterior spinothalamic tract carries the sensations of touch and pressure, kind of generalized touch. If something touches you on your body or if something puts pressure on you, that information would go up to your brain via the anterior spinothalamic tract. The lateral spinothalamic tracts, they would be out here in the lateral columns out here. Okay, so these tracks are going to bring up the sensations of pain. So any pain that you feel from your body, that's going to go up the lateral spinothalamic tract, and then also temperature, right? Anything hot or cold. The last two tracks, if you just want to jot in your notes over here, I didn't put it down. Both of these here are posterior column tracks. We find them in the posterior column. You can't tell that from the name, but they would be back in here. Okay? So they both have the same name, fasciculus, and they both carry the same five sensations. The difference in their name is the first one is called the fasciculus cuneatus, and the second one is called the fasciculus gracilis. So the fasciculus cuneatus carries these five sensations, and I'll describe what I mean by them in a second. Discriminative touch, proprioception, stereoagnosis, vibration, and weight discrimination, highlight right here, from the upper body. While the fasciculus gracilis does the same five, but watch this, from the lower body. Okay, so they're both carrying the same information to the brain. It's just that each track is coming from a different area. So discriminative touch is much more precise type of touch, right? If I took a needle and I put it on your body, you would be able to precisely tell me where it is, right? You're able to localize it really, really well. That's discriminative touch. Proprioception is position sense. This is feeding information to the brain as far as where you are in space, right? How much your joints are flexed or extended, how fast your joints are moving, the position of your body, right? Are you standing, are you sitting, are you lying down? It just tells the brain where you are in space. Right? We call that proprioception. Stereoagnosis, this is the ability to recognize something by feel. right? If I had you close your eyes, this is how we would test a patient. I have them close their eyes and then put a familiar object into their hand, and then with their eyes closed, they feel it, and they, not smell it or anything like that, just by feel recognize, oh, it is a key, right? Or it's a coin, something again that's familiar to them. And that we call stereoagnosis. Again, these tracks bring that information to the brain so that the patient or you can make that determination as far as what it is. Vibration is vibration, so anything that's touching your body that's vibrating is going to go up through the posterior column tracts, the fasciculus cuneatus, and the fasciculus gracilis. The fifth modality is known as weight discrimination. So again, you would close your eyes, we would put something in your hand and say, how much does this weigh about? And you go, oh, it's about an ounce or it's about a pound, right? You kind of make that determination without looking at it. That information also goes up through the fasciculus cuneatus and the fasciculus gracilis. Right, so both of those are located in, as I mentioned, in the posterior column. They both carry the same 5 modalities. It's just that they're coming from different parts of the body. The fasciculus cuneatus is from the upper body, while the fasciculus gracilis is from the lower body. Okay, guys, so those are the 4 ascending tracks. They're sending information to the up to the brain. Now, there are a number of descending tracks that are carrying information down from the brain to the spinal cord. These are known as descending tracks. I'm going to only show you 2 of them. These are kind of the more important clinical ones. If you ever go on in your studies, you can learn some of the other ones. The first one is called the anterior corticospinal tract. Right, so again, anterior means it's in the anterior column, and then cortical means the cerebral cortex. So it's coming from a part of the brain known as the cortex, and then it goes down to the spinal cord. Right, so again, the name kind of tells you the direction that the action potentials are flowing. Cortico, spinal, right, from the brain to the spinal cord. Now, this tract, for the most part, is controlling the movement of our trunk muscles, right? So if you were doing like sit-ups or just your postural muscles that keep you upright, any of these trunk muscles is going to be, these tracts are going to come down the anterior, or these neurons, I should say, are going to be located in the anterior corticospinal tract. And then controlling the muscles of the limbs, right? The upper limbs and the lower limbs are the lateral corticospinal tracts. So again, they would be out here in the lateral columns, right? The anterior corticospinal tract would be somewhere in here. Okay, so these are 2 motor tracts. So again, any one of these tracts could be affected with diseases like MS, and then same thing here. Even these could be affected by diseases with MS. So the patient would also have motor disturbances, right? Maybe some type of paralysis or weakness in their muscles, that type of thing. Okay, so just the last 2 slides here to give you a little bit of an overview. This is just an overview of sensory information coming in. Remember we said that sensory information comes in the posterior horn. So now watch this, guys. This spinal cord is reversed of what I had before. How do I know that? Here's the anterior median fissure. So this time the anterior side is down here, but on our other pictures it was up over here. So just realize it's reversed. So sensory information coming in from, say, the back of our body, like on your back between your shoulder blades, and then from your arms or the front of your chest, those sensory informations are going to go in the back part of the spinal cord right here and enter the posterior horn. So you can see the sensory information going in, as I mentioned before, in the back door, right, in the back door. Where motor information leaves the front door, right? Here's the anterior horn. So this blue neuron here would be like the lateral horn where the visceral efferents are. So if we follow this blue axon coming out here, this is actually going to go into this area here and then go out to an organ, let's say to your heart, right? Or to the, your blood vessels or something like that. It's going to go to a viscera. where this neuron here in the anterior horn, this is going to go out to skeletal muscle. So we follow this one here, right? It's going to go out to say, your skeletal muscles to make your muscles contract. Right. So the main thing right now that I want you to know is, sensory information again comes in the back door. Motor information comes out the front door. It's like this: if you're at your house, you were only allowed to go into your house through the back door, into your kitchen. And then when you leave your house, you can only go out through the front door from your living room, right? So it's always that way: in the back door, out the front door. Sensory in the back, motor out the front. Okay, so that concludes this lesson on the internal anatomy of the spinal cord.